Hi, everyone. This is Professor Brandon Beatty. I thought that I would tease out some of the hormone content from the Intro to Endocrine session. That way you could have this as an additional study guide. So as you'll recall, that pituitary gland is going to be the master gland, and that's going to be responsible for coordinating this hypothalamic pituitary axis. It's going to be influenced by the hypothalamus, and neurohormones are going to be delivered to the pituitary gland. In the anterior pituitary gland, it's going to occur by the hypophyseal portal veins. I've got a picture next that's going to show those things. And then from there, that neurohormone is going to bind to a specific receptor in the pituitary gland, which is going to ultimately then trigger hormone release. And all of this is relying on that negative feedback loop to then turn off the hormone stimulation when there's enough or if there's too much. And so these HPA, the hypothalamic pituitary axis, is going to regulate the secretion of hormones in various body systems. And the main goal here is going to be to maintain homeostasis. And we're going to see how this is impacted in the next few slides. So this is a cartoon. You can see here that we're zoomed into that pituitary gland, and then we're able to see the hypothalamus connected here to the pituitary gland by the infundibulum. And then we have the anterior pituitary gland and the posterior. It is important that you know which hormones are coming from where. So the posterior pituitary gland is responsible for secreting two hormones, ADH, or antidiuretic hormone, and oxytocin. All the other hormones we're going to talk about come from this anterior pituitary gland. That's going to be ACTH, TSH, GH, prolactin, FSH, LH, and lastly, MSH. And I have a slide that's coming right next that's going to show you all those things, and we're going to work through that together. So very busy slide, but we'll make sense of this all together. So we're seeing here the anterior lobe of the pituitary gland. This is going to be controlled by the nervous system. And so as the nervous system secretes things like epinephrine and norepinephrine, it's going to then act on the anterior pituitary gland to secrete a whole host of hormones that we're going to work through. For the posterior pituitary gland, recall there's only those two hormones, antidiuretic hormone and oxytocin. This is going to have a direct release of the hormone. So these hormones are released directly from here and go act directly on the target. So there's a little bit of a difference there. So as we look here at this first hormone, we're looking at ACTH, adrenocorticotropin hormone. So what happens here is that we're going to get cortisol releasing hormone, CRH, from the hypothalamus. It'll act on the anterior pituitary gland to secrete ACTH, which will then go to the adrenal gland, where it will secrete things like epinephrine, norepinephrine, and cortisol, which is a glucocorticoid. We're going to talk about that in your adrenal section. Next, we have thyrotropin releasing hormone, TRH. That's going to act on the anterior pituitary gland. It's going to result in the secretion of thyroid stimulating hormone, TSH. It'll act on the thyroid gland to secrete thyroid hormone, T3 and T4. We'll talk about that in your thyroid session. Next, we're going to have growth hormone releasing hormone, GHRH, from the hypothalamus. It's going to act on the anterior pituitary gland to secrete growth hormone, which is then going to go to the liver to create this somatomedina, and it's going to act on a whole host of things, so bone, muscle, and other tissue. Next, we're talking about prolactin. I don't think it's important that you know the precursor, but prolactin will come from the anterior pituitary gland, where it will act on the mammary glands. This plays an important role in nursing for breastfeeding. Next, we're talking about the sex hormones here. So again, I don't think it's important to know the precursor, but we have follicular-stimulating hormone, FSH, and then luteinizing hormone, LH. For your biological male patients, this will act on the testes to secrete inhibin and testosterone. And then FSH and LH will act on the ovaries of biological females to secrete estrogen, progesterone, and inhibin. Lastly, we're talking about melanocyte stimulating hormone. I don't think it's important that you know the precursor. These are going to act on melanocytes. We're not quite sure what they do, but just recognize that that's a hormone that comes from the anterior pituitary gland. It's not one we're going to be focused so much on in the endocrine section. Lastly, we have those two posterior pituitary hormones. So we have ADH, antidiuretic hormone. This also goes by arginine vasopressin, AVP. It's going to act on the kidney. It's going to be helpful for regulating blood pressure, amongst other things. And then lastly, we have oxytocin coming from the posterior pituitary. Not important that you know the precursor, and that's going to act on biological females, on the uterine smooth muscle, and the mammary glands. In your biological males, it's going to act on the smooth muscle and the ductus deferens and the prostate gland.